Cryotherapy is an innovative treatment where the body is exposed to very cold temperatures of up to minus 140 degrees Celsius, minus 220 degrees Fahrenheit, in order to encourage 7 key benefits: beauty, athletics, weight loss, muscle recovery, mood, pain management, and sleep. Born from nature and made safe and effective through technology, the use of low temperatures in healing dates back to 2500 BC, but then it was modernized by Japanese doctor Dr. Yamaguchi in 1978 to help treat patients with rheumatoid arthritis. How does it work? Your cryotherapist will accompany you to the treatment room where you will enter into a cryo chamber. This is where we conduct our whole body cryotherapy sessions. Once you step in, your body is briefly enveloped with cryogenically cooled air. You will be in there for a maximum period of 3 minutes. Cryotherapy is helpful for recovery purposes as it can reduce inflammation, boost blood circulation with a faster recovery time. Cold air narrows the blood vessels and reduces the blood flow to inflamed or painful areas. This in turn slows down nerve transmission, so the brain receives fewer pain signals. The treatment reduces inflammation by decreasing the number of pro-inflammatory cells that cause sensitivity and pain. Research supports the view that cryotherapy can aid in fitness too, by activating the body's fight or flight mode. Adrenaline is released, which prepares your body to either run or fight the cold. This causes most of your blood flow to be sent to your core organs in an attempt to maintain a safe internal body temperature. Meanwhile, your heart rate and blood circulation increases, so that more nutrients and oxygen can reach your major muscle groups. In practical terms, it gives your muscles a power boost, meaning you can train harder for longer and become a stronger athlete. At Cryo, we offer 3 core treatments: Cryo Body, Localized Cryo, Cryofacial.
In a world where we seek alternative answers for our health and well-being, cryotherapy may be the optimal treatment option to save the body from pharmaceutical use or surgical procedures. Cryotherapy is a cold therapy process involving many treatments that are known to heal, reverse the signs of aging, and reduce pain and inflammation. Forms of cryotherapy have been used for centuries but were first implemented clinically in Japan in 1978 as a remedy for rheumatic disorders. Now it is being adopted by other countries, expanding its uses and becoming more mainstream. Cryotherapy is used in healthcare in many ways. A well-known form of cryotherapy used today is icing after an injury or in muscle disorders. It aids muscle, joint, and soft tissue pain by decreasing swelling and promoting healing and flexibility. This can be done by either icing the injured portion of your body or even submerging your whole body into an ice bath for a short period of time. It is also used to safely apply localized cooling agents such as liquid nitrogen or argon gas to freeze and kill abnormal tissues and cells in conditions such as warts and even cancer. Cryotherapy is also used in the cosmetic world. It can help improve the tone, texture, and elasticity of your skin, along with reducing the appearance of fine lines and wrinkles. This is done by administering cryofacials, which increases the blood flow to the face. Cryotherapy is also thought to aid in weight loss by increasing the metabolism, which is done by exposing your whole body to very cold temperatures for a short period of time. Although some forms of cryotherapy are FDA approved and covered by insurance, including wart removal and treatment of cancers, others, such as whole body cryotherapy that can be beneficial to muscle and pain disorders, are not. More studies are needed to prove the efficacies of cryotherapy so that FDA approval and insurance coverage is more readily accepted.
Benefits of cryotherapy, internal and external conditions. While cryotherapy can help with providing antioxidant effects, anti-inflammatory, and analgesic effects, we need to bring to light that cryotherapy can also treat internal and external conditions. As we see in the picture to the right, cryotherapy is treating warts. Usually, liquid nitrogen is used on a cotton ball or a spraying device to apply extreme cold to the cells. This then kills the cells after the treatment because they cannot survive the extreme cold. This is an example of cryotherapy being used to treat external conditions. Other external conditions besides warts treated by cryotherapy can be skin tags or dark spots. Cryotherapy for internal conditions has become popular with patients and doctors because of being less invasive due to going through a small incision and freezing the cells instead of having to take everything out. The internal conditions cryotherapy can help treat are precancerous cells and other internal conditions like bone, cervical, prostate, and liver cancer. Recovery. When talking about recovery with cryotherapy, one can think of the actual recovery from a sport or a car accident, or the recovery after a cryotherapy procedure. Cryotherapy being used before and after a sport will optimize its benefits. After an accident, cryotherapy can be used as well. Recovery after cryotherapy use with an internal or external condition procedure is less severe than other procedure options. Targeting only the cancerous cells as well as not being a big incision can make the recovery process less severe for the patient. Going back to thinking about having less inflammation, aka less soldier cells making the pressure higher in the areas, decreasing the risk for infection and redness around the procedure will not be there if cryotherapy is used.
Cryotherapy significantly decreases the need for long-term pain management and opiate use. Most procedures only require NSAIDs for pain management. Cryotherapy also treats both internal and external conditions, such as skin conditions like warts on the skin, to precancerous cells, low-grade bone, cervical, liver, and prostate cancers, just to name a few. The benefit to using cryotherapy is that it is minimally invasive. This means it reduces anesthesia demands, the length of time in surgery, hospitalization, bleeding, pain, immobility, complications, overall recovery time, more safe options for those at high risk for complications with surgery.
A study conducted by Rheumatology International measured whole-body cryotherapy effects on patients diagnosed with fibromyalgia. Fibromyalgia is characterized by chronic generalized musculoskeletal pain, hyperalgia, and allodynia, which is pain from a stimulus that doesn't normally cause pain, such as the brush of a feather. Symptoms of fibromyalgia include fatigue, sleep problems, anxiety, depression, paresthesia, joint stiffness, headache, the sensation of swelling, concentration difficulties, and memory impairment, as well as unexplained symptoms. 30 participants in the study received 10 treatments every other day for 3 weeks that involved standing in a CryoSense TCT cabin for 3 minutes while the temperatures reached extreme temperatures of negative 196 degrees Celsius or negative 328 degrees Fahrenheit. The study showed that the whole-body cryotherapy not only decreased the pain levels in the participants, but also improved other fibromyalgia symptoms and improved the quality of life. While the study's results were positive, the improvements didn't last longer than a week.
According to recent research, the global cryotherapy market size was valued at $7 billion in 2022 and is expected to continue to grow at a compound annual growth rate of 7% from 2023 to 2030. Some of the major factors propelling the growth are the rising demand for least invasive procedures, pain management, high prevalence of skin disorders, and chronic diseases. There has also been an increase in demand for cryotherapy in beauty and wellness clinics and fitness centers. The cryotherapy market was adversely impacted by the COVID-19 pandemic. During the pandemic, a slowdown in demand and disruption in supply of cryotherapy products was observed due to the strategies that were designed to curb the pandemic. However, the impact of COVID-19 reduced significantly by the end of 2020. Furthermore, cryotherapy is gaining popularity, with athletes and celebrities adopting it as a new trend. All of these factors are projected to accelerate the market growth.
Contraindications. With any treatment or therapy, there are always contraindications. While cryotherapy is still taking on new forms in the healthcare and cosmetic world, we have been able to identify some groups of people who are unable to utilize it as a treatment. Those groups include people with hypertension, heart and lung disease, circulatory complications, hypersensitivity to cold, for example, Raynaud's, neuropathy, and women who are pregnant. Cryotherapy causes vasoconstriction of blood vessels, which can impede blood flow throughout the body. Proper health screenings are very important before recommending cryotherapy to patients who are looking for alternative treatments.
So on this slide, we're focusing on the cryo chamber. The cryosauna is a chamber where gas from nitrogen drops the temperature to hypercool the individual. First, blood vessels contract, increasing blood flow to the athlete's internal organs. These organs can impart beneficial nutrients and high oxygen levels into the blood. Vasoconstriction allows for more efficient flushing of toxins and lymphatic drainage from damaged muscle tissues. After treatment, blood vessels quickly expand, allowing the freshly enriched blood to flow back to the skin surface, as well as the damaged muscles and joints that have been purged of toxin buildup. Rapid vasodilation also stimulates endorphin release to relieve pain and decrease inflammation.
How to treat a wart or skin imperfection with liquid nitrogen cryogun. First, the doctor will remove the blister or thick skin with a sharp knife. Then they will use the mini cryogun to apply liquid nitrogen at negative 196 degrees Celsius for up to 10 seconds. This can be repeated up to 3 times. They are looking for a 2 millimeter white halo to appear as shown in the picture. The patient will feel frostbite at first and then a hot burning sensation. For the pain, they may use Tylenol then during the treatment and up to 3 days after if they have throbbing pain. Afterwards, the wound can form a blister and then crust over and turn a brownish red. Following that period, the scab will fall off and the area will be healed with minimal scarring. Typically, it is done at least 2 times to make sure that they have gotten everything they need to get, and the next treatment will be 4 weeks later. During the healing process, the patient must keep the area clean and covered with a Band-Aid for 4 weeks. If it's repeated, the same process will be used. This is my personal experience with cryotherapy. 15 years ago, I had 2 warts on my arm. One on the left was smaller than the one on the right. I went into the doctor after trying several attempts at home to get rid of the warts and they wouldn't go away. The doctor used the cryo gun and treated them with liquid nitrogen. It was a little bit painful as the freezing was happening, but I followed the procedures and went home and kept it covered and clean. Unfortunately, the one on the right formed a ring of smaller warts around on the perimeter of where the original wart was. I went back 4 weeks later and he did another treatment to both areas, but the treatment on the right had to be a larger diameter to inoculate all the extra smaller warts. So that's why if you look at the picture, you can see the scar on the right is a little bit larger. After that treatment, the warts never came back. I have minimal scarring and I've had no future issues. I'm happy I did this.
We thank you all for watching and hope you enjoyed our presentation. We have provided below some locations. Each location has different services. And you can also find cryo services at dermatology offices. Thank you.